Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
Thanks for joining me. Today we're going to be extracting this lower wisdom tooth, tooth number 17, right there, I've circled it. So as I go to extract this tooth, before we extract it, I let the patient know there's two things I'm going to be worried about. One is the crown on the tooth right in front of it. It's an all gold crown that's been there for a while. Let them know that sometimes crowns can come loose during an extraction. And then otherwise, it's these down here, the root tip. From the X-ray, it looks like there's quite a hook on the end of that. So it's most likely that's going to break off when we remove the tooth. So we'll probably have to go digging for it. Okay, so for the lowers, got them nice and numb. I always like using a bite block on the lower jaw. Just it lets the person bite down a little bit, stabilize their jaw a little bit. Numbed them up with some Septicane. Now just taking my spoon excavator, just checking around the tooth, making sure it's numb. And my go-to first instrument is my spade proximator. So on a wisdom tooth, I will work it on the buccal side of the tooth just to get some movement of the tooth. And then also on the mesial side, mesial being in between that tooth and the crown. And there you can see it's moving already. And I'd like to get the tooth moving with elevators with either the proximator, straight luxator, or 301 elevator as much as possible before I grab it with a pair of forceps. That way, in case if a part of the tooth breaks, and from the x-ray it's got that little hook on the root tip, here I'm switching to the 301, we know that root tip is most likely going to break off. So if I can get the whole tooth moving in one piece, once I remove the tooth and I go digging for that last little root tip, it's already going to be loose in the socket. It's not going to be firmly in there. If it were firmly attached still and I'm trying to go elevate that out, it'll make it more difficult. So I just spend a little extra time, again, just working it back and forth. And again, if this tooth did not have that little hook on the end, just what I'm doing here with the spade proximator and the 301 on both sides would get it out. So in addition to loosening the tooth up, by using the 301 and the spade on the buccal side, it's also opening it up a little bit so that when I go to grab it with the forceps, I can grab the tooth down lower under the gum line. And so for lower molars too, I always use my cow horns. That's my first go-to forceps if I can do it. Cow horns, the beaks are pointed and curved, and so when you put them on the tooth, you press it down, get it down as far under the gum as you can, squeeze it, and that by squeezing it, the shape of the beaks on it gets the tips to go even further down, and as it dries further down, tooth's going to want to pop up. So we'll just pump it, squeeze, pump, and now I'm doing some figure 8 motions to get the tooth moving out of there, and I'm moving it. It's really coming, and there we go. And let's take a close look at it. Yep, I think there's a piece. The piece is definitely missing. Let me just grab some gauze, wipe that off. See, there you can see where the root tips is supposed to be, and it's not there. It's always very important to check to make sure if the root tip broke off or not. Now I'm going to get in there with my surgical suction and check and see if I can see it. So there you can see it right there. Let me circle that for you so you can see it better. Key thing when extracting, going after broken root tips like this is visibility. You can see it. You need to be able to see what you're doing. So you definitely need surgical suction. I use magnification when I'm pulling teeth, and I always use a nice bright headlight. So I have plenty of light down where I need it to be. Now I'm just taking my mesial angled proximator to get down in there. And since I already know that the root tip is a little loose from all the previous elevating I've done, it's just a matter of teasing it out, of getting it out of there. A lot of times I can just kind of use that distal angled proximator and pop it loose and then grab it with the suction to get it out of there. Let's see if it's coming. Did we get it? It's still in there. I can still see it way deep down under there. So let's go back a little bit more proximator action. Try to work it all around on this side. I also have a mesial angled one. I have a pair of root tip forceps too, but let's just try to get it with this one. I think we'll be able to do it. There you can see it. It's just frustrating sometimes because You want to get it out, but it's just a matter of finding the right spot. I think we got it, and there it is. Popped it loose finally, got it, grabbed it with the suction. Decent sized piece, so let's go back in there, make sure it's all cleaned out, nothing's in there. And also on times too, when there's a root tip broken off and you're not sure where it is or if you got it all, by all means, take an x-ray to make sure you got it all. Once I get the pieces out, if it came out in a big chunk, I like to put it back together to make sure it looks like it looked on the x-ray. And there you can see I had a pretty big hook on it. And there was no way that was coming out in one piece. Unless it had been really periodontally involved with a big abscess on it. So, a lot of fun. And now here's a close-up of the tooth. So we pulled this tooth out because it had a cavity on it. Person was already missing the upper one, as you could, if you remember the x-ray. And when a wisdom tooth's got a cavity on it, I give people the option. We could either fill it or we can pull it. The tooth wasn't bothering the person. In this case, person said, you know what, just get rid of it. I'm missing the other one. Let's just take it out. And that's what we did. And there you can see that tip again. Pretty big hook. That's the biggest one I've seen like that. It's crazy. Usually, in my experience, lower wisdom teeth tend to be a lot more fused together, more conical shape. But that's the first time I've seen one with that big a hook. All right. Thanks so much for watching. Hope you enjoy these extraction videos. Please give me a thumbs up if you do enjoy it, and we'll see you in the next one.